So I'm here performing a bag manual ventilation for an intubated patient. So first is I'm gonna check the patient's chart, and then after I have to check everything about the patient's details. And then once I'm going inside, I'm going to wash my hands, apply PPE such as a face mask, goggles to protect my eyes from splashing of fluids, gown, and even most importantly gloves. So once I'm going to go inside, I'm going to introduce myself, especially for the physicians, that I'm a respiratory therapist. I'm going to help especially during intubation. So we're gonna have already intubated already. So I am here preparing the first is the ambu bag. So when checking this one first, I have to insert it directly to the flow meter and then set the flow to 15. And then important thing when doing this one, prior to putting this to the ET tube, we have to observe if there will be any malfunctions on it, and we have to check any connections or any leaks. So, and also we have to observe the reservoir bag if it is totally inflated, or if not, we have to replace another ambu bag. So now that I observe that it's totally inflated and it's ready to use, I'm going to put this one to the ET tube adapter. And then another thing is if I'm capable, especially if it's not hard to me, I can do it jaw thrust or a head tilt chin lift, or I can also ask assistance to do the head tilt chin lift or jaw thrust. And then once I'm going to put this one, pretending it's already been secured, we also have to make sure that we're going to hold the ET tube to prevent during bagging to accidentally moving, even though it's already secured. And then we also have to ensure that the pilot balloon is inflated to prevent any leaks. And so when doing this one, we also have to observe the chest rise or if any spontaneous breaths. So right now I'm going to do a manual ventilation, and then we're going to observe chest rise. So pretending, I'm sorry because the mannequin's directly in the right side for the tube. So every time we give manual ventilation, we have to observe the chest rise, and then we also have to observe any leaks directly from the ET tube. We will notice it if there's air coming out directly from the patient's mouth, like that. And then if we notice the patient is breathing spontaneously, we have to coincide with the patient's breath to be synchronized with the manual ventilation. That. So now that we're done, and then the mechanical ventilator is in place, we're going to remove this one, and then we're gonna put the mechanical ventilator, the ET tube, and then we're gonna assess the patient. One of the things we're gonna do is especially check the patient's chest rise, auscultate the lungs if the ET tube is in place, both left and right, and then check with its SpO2, assess the patient and also color of the patient, and also we can also put a capnography, especially to check the end-tidal CO2 for the patient. So now that we're good to go, we're going to remove the PPE, and then we're going to wash our hands and document everything during what our observations are during the manual ventilation.